Benzodiazepines can be impossibly hard to quit. It's been said that they're more difficult and dangerous to withdraw from than heroin. Even though most people on benzos are using them responsibly, as directed by a doctor, there's so much stigma and misinformation surrounding these drugs that it can make quitting even harder. Here are 5 myths you should know about before starting or stopping a benzo. Myth number 1. If you have a hard time withdrawing, you're an addict. Addiction and dependence are 2 different things. Addiction is compulsive, out-of-control drug use despite negative consequences. In this situation, benzos are abused at high doses, often in combination with other drugs to achieve a high. Someone with an addiction may or may not become dependent. Dependence is when your body adapts to being repeatedly administered a drug. These adaptations to your body chemistry are what cause a withdrawal reaction when you stop. Regular exposure to benzodiazepines can cause the receptors in your GABA neurons to internalize or retract. This means less GABA in your system to help you relax muscles, calm anxiety, and fall asleep. These chemical changes are so severe in some people that suddenly stopping a benzo can lead to seizures and even death. Myth number 2. You're safe as long as you're on a low dose. Many of the newer benzodiazepines come in deceptively low doses. Ativan, or lorazepam, is 10 times stronger than Valium, meaning 1 milligram of Ativan would be like taking 10 milligrams of Valium. And Klonopin and Xanax are even stronger, 20 times more powerful than Valium. Many people think you should be able to just walk away from half a Xanax or Klonopin with no problem. But in reality, that half a milligram packs a punch equal to a full 10 milligram Valium pill, the biggest Valium pill they make. Myth number 3. It's easy to stop a benzo if you've only been on it a short time. But what is a short time? According to some medical experts and drug companies, benzos shouldn't be used longer than 2 to 4 weeks. Anything longer is considered the danger zone for developing dependence and withdrawal syndrome. Speaking of withdrawal, remember how GABA neurons adapt? Some people's brains do this in less than 1 week. Then there's kindling. Kindling happens when you've stopped substances like alcohol, benzos, and other tranquilizers more than once. Kindling means every time you get back on and try to get off a benzo, you experience more and more severe dependence and withdrawal. Kindling doesn't happen to everyone, but it's a big problem when it does. Myth number 4. It only takes a few weeks to withdraw, and then you're done. Okay, for some people, this is actually true. But for many, it's not. Remember those injured GABA receptors? Just because there are no more benzos beating up your neurons, that doesn't mean you will be able to reverse all that damage in just a few weeks. We don't know why some people are able to reverse those mutations faster than others, but while some people heal quickly, others can take months to heal, and others will take years. That's years of withdrawal-like symptoms, all from taking a medication as prescribed. Myth number 5. You can just replace benzos with other medications. Only a benzo can replace a benzo. Antidepressants, antipsychotics, blood pressure medications, these don't even touch the same receptors as benzodiazepines. Many people find that using different drugs to treat withdrawal symptoms provides very little relief and can even make things worse. Substituting your benzo with other tranquilizers like barbiturates and sleep aids may seem like a good idea, but that's like jumping out of the frying pan and into the fire. You're still beating up on your GABA receptors, and when it's time to jump off the new tranquilizers, you're right back where you started, or maybe even worse. Many people find themselves medicating new symptoms and illnesses that develop while taking a benzodiazepine. Some mimic mental illnesses like anxiety, OCD, and psychosis. Others look like anything from fibromyalgia to Crohn's disease and multiple sclerosis. Most people don't realize the benzo is to blame. Whatever new diagnosis you land on, other medications won't reverse the damage. Treating the symptoms of an undiagnosed benzodiazepine injury is like chasing your tail, as symptoms get worse and worse, despite medical treatment. Don't buy into the myth that benzos are safe as long as you're not an addict or taking your drug more responsibly than the next guy. There's always a risk. It's just a matter of luck and time. More importantly, don't ever suddenly stop taking a benzo. And think twice before spending thousands of dollars on rehabs or detox facilities that might pull you off too fast and can pressure you into taking even more drugs. The benzo problem is more complicated than people think. But with the right resources and careful planning, you and your doctor can develop a plan to get you safely off benzos for good.